Councilor at Large Michael Flaherty, the Chair of Government Operations. We are here today to discuss Docket 0382. It's an order for a hearing regarding the proposed 13 hospital merger of Caregroup Incorporated. It's the parent company of Beth Israel Deaconess Medical Center, as well as Lahey Health System. This matter was sponsored by my colleague, City Councilor Tim McCarthy, along with my colleague, City Councilor Ed Flynn, referred to the committee on March the 7th of 2018. This hearing order seeks to bring together all the stakeholders and the impacted groups of the proposed merger. The Commonwealth's Health Policy Commission, HPC, the Attorney General's Office, and other authorities are currently reviewing the application for this merger. Components of the application include the merger's impact on access to health care, costs, and overall health care marketplace. Note, while the AG's office was invited, they're not attending due to the ongoing discussions in this matter. However, Kevin Tabb from Mass Health Policy Commission was also invited as well, but had a scheduling conflict. So if approved, the merger would result in creating another powerful hospital market on par with Partners Healthcare and increased market leverage. For the record, as the Chair of Government Operations, I would like to note that while this hearing is hosted by the respective committee, the Boston City Council does not have any legislative oversight on the merger, and thus no formal vote will be taken in support or against the merger. This is purely an educational and informational public discussion. However, it is our intention to have an active role in this process that will affect residents across the city. At this time, I now turn it over to the lead sponsors, my colleague, City Councilor Tim McCarthy, followed by City Councilor Ed Flynn. Councilor McCarthy.
Thank you very much, Mr. Chair, and welcome everybody. It's nice to see everybody here today. As the Chair said, this is an educational hearing, really a forum to discuss the possible merger. When Councilor Flynn and I heard that, all right, here we go. When Councilor Flynn and I heard that the merger was happening, we had a discussion, and that discussion really revolved around our most vulnerable citizens. As District 5 City Councilor, I have several community health plans and community health care providers in my area. And obviously, I'm very concerned about the citizens that live in District 5, as well as the citizens that live in Boston, especially the most vulnerable citizens. So when we were alerted to the fact, or to the thought that this merger may cause some issue with those citizens, we felt it was our duty to at least have an educational forum to get both sides of this. And as Councilor Flaherty stated so eloquently, we do not have any jurisdiction here. But we certainly can be educated on this topic and speak for our citizens and for our constituents regarding the merger. So that's what I'm really eager. I feel like I'm in a classroom here. I'm really eager to learn exactly what the bonuses are and what the possible side effects of a merger would take place. So I'm looking forward to the discussion. Thank you very much, Mr. Chair.
Thank you, Councilor McCarthy. Chair recognizes Councilor Ed Flynn.
Thank you, Mr. Chairman. Thank you, Mr. Chairman. Councilor McCarthy and I we called for this hearing regarding the proposed 13 hospital merger, Caregroup, the parent company of Beth Israel, and Lahey Health System. Reports have indicated that if approved, the merger could be the largest in the history of Massachusetts. Moreover, Beth Israel, Lahey Health would control maybe 1 in 3 hospitals in eastern Massachusetts and become the biggest health provider in the region. I want to say thank you to Councilor Flaherty, Councilor McCarthy for their efforts, and I'm happy to work with them to raise awareness on this issue. This merger may or may not have a major effect on the most fragile residents in our community. Therefore, I believe that it is necessary to hear from the experts and those impacted before any decisions are finalized. My focus on this issue stems from significant concerns that we have heard in recent years relating to potential hospital mergers. At the same time, public discussion centered on the impact a potential merger could have in terms of increasing market power, the ability to negotiate with insurance companies, and raising health care spending. It is my hope that this hearing will also enable us to learn more, as Councilor McCarthy said, about this merger and the impact it would have on other hospitals, as well as local community health centers here in the city of Boston. Perhaps this hearing will also help us understand what effect, if any, this merger would have on access to health care for middle and low-income residents, communities of color, our immigrant communities, the elderly, the poor, the disabled, our most vulnerable. And I'm also looking forward to hearing from the experts, but I'm also looking forward to hearing from a group from South Boston Action, a group of Hispanic leaders in the community dedicated to helping those get access to health care. Thank you, Mr. Chairman.
Thank you, Councilor Friend. We've also been joined by City Councilor Josh Zakim and City Councilor Kim Janey. Councilor Zakim, opening comment?
Mr. Chairman. Good morning, everyone. I want to thank the sponsors for bringing this forward. I just, as the City Council representing not all of these institutions, but certainly BIDMC and the Baptist, I had the opportunity to testify at one of the state hearings on this late last year in support of this merger, and I was joined by many of our Mission Hill residents and neighbors who were speaking to the positive impact these institutions have had on our neighborhood, both as good neighbors, but in particular, I think the Baptist does have a special place in the heart of many of my constituents up on Mission Hill, and has been a wonderful institutional neighbor over the years. I certainly share the concerns of, I think, probably everyone in this room about rising healthcare costs and equity, and I look forward to learning more today, to following up, and also entrusting the process through the Health Policy Commission, the Attorney General's review, and the many other stages of review over here. As I've been reminded by some of my colleagues before, this body does not always have legislative authority over some of the hearing matters we have here, but this is an important venue for residents of the City of Boston and surrounding communities to learn more about issues like this that affect them in their day-to-day lives and certainly in their health care needs. So I'm happy to have this hearing. I do just want to reiterate my support and the partnership I've had with these institutions over the years, in the last 4.5 years as District City Councilor, representing many of them, and I look forward to learning more. I want to thank again Councilors Flynn and McCarthy for bringing this important matter before the Council.
Thank you, Councilor Zakim. Chair recognizes Councilor Kim Janey. Any opening statement at this time?
Yes, good morning. Thank you, Mr. Chair. I also want to recognize and thank the sponsors of this hearing. Also appreciate the panel before us and all those in attendance. I'm here to listen and to learn. Unfortunately, I'm not going to be able to stay the entire time, but look forward to watching the video.
Thank you, Councilor Janey. We've also been joined by City Councilor Ayanna Pressley. Any opening comment at this time, Councilor?
Oh, yes, thank you, Mr. Chairman. Good morning. Thank you, Councilor Flynn and McCarthy, for elevating this important conversation about public health in our city. This merger will have the second largest inpatient, outpatient, and primary care market shares in the state, nearly equal to partners. We must practice our due diligence to ensure we understand all the factors before and after this merger for our current residents, their public health, and also the impact on this workforce. Especially interested in what that will be. Looking forward to hearing from the representatives of this merger and reaching clarity around my own questions. I too apologize in advance that I will likely not be able to remain for the duration of the hearing, but will stay for as long as I can and watch the tape later. Thank you.
Thank you, Councilor Pressley. So this time I'm going to turn it over. If folks are kind enough to introduce themselves for the record when they get a chance to speak, we're going to start with Dr. Stan Lewis, who's a cardiologist and Chief Systems Development and Strategic Officer for Beth Israel Deaconess. So welcome to the Boston City Council chambers, and you have the floor, sir.
Thank you. Thank you, Councilor Flaherty and members of the Council, and thank you all for inviting us here today to speak to you about our plans to create a new integrated healthcare delivery system for the benefit of the residents of the City of Boston and beyond. My name is Dr. Stan Lewis. I am a cardiologist and serve as well as a Chief System Development and Strategy Officer for Beth Israel Deaconess Medical Center in Boston. It's our goal today to provide you, and my goal to provide you with background information on BIDMC and the New England Baptist, and why we are coming together with other organizations to create this new system of care. By way of background, the founding institutions of BIDMC were created more than 120 years ago to specifically serve underserved populations in the greater Boston community. And today, I think we're all proud to say that BIDMC remains true to that founding mission. We have unparalleled infrastructure to care for highly diverse and vulnerable populations, including more than 100 interpreters and diverse clinical staff. And last year, we served over 200,000 patient encounters in more than 70 languages. Both BIDMC and the Baptist are critical healthcare providers in the city of Boston, providing 24/7 trauma care, highly complex hospital care, world-class orthopedic care, and a range of important medical and behavioral health services for the benefit of all of the patients in this community, regardless of their insurance status or ability to pay. While we're a major Level 1 trauma center and a world-renowned medical research and Harvard teaching hospital, we are truly privileged to serve and will always serve as the local community hospital for many Boston residents. We have strong clinical affiliations and provide clinical programming and financial support to several community health centers throughout the neighborhoods of Boston. The community health centers are on the front lines of service to vulnerable patients and would otherwise lack access to local primary care, mental health, substance abuse, and dental care. These health centers specifically include the Bowdoin Street Health Center in Dorchester, Charles River Health in Brighton, the Dimmock Center in Roxbury, Fenway Health in Boston, and South Coast Community Health Center in Chinatown. As you all know, BIDMC and the Baptists are major employers in the city of Boston. Together, we employ well over 11,000 people and provide thousands of needed jobs to Boston residents, with over 1/3 of our workforce proud to call Boston their home. Our employees, the heart and soul of our organizations, continue to provide feedback that's critical and counsel on our journey to create this new, high-quality, lower-cost healthcare system. And we are delighted to celebrate together the unanimous approval of our new system by the Commonwealth's Public Health Council just last week. We are longstanding and committed partners to a host of neighborhood and community-based nonprofit organizations across the city. These organizations are dedicated to serving our youth, our elderly, our newcomers, and other vulnerable populations. And later you will hear from the Director of Community Relations at BIDMC, Jane Matlaw, who will discuss this important issue further. BIDMC was proud to serve on the City of Boston Pilot Task Force that created the city's new pilot program. Our hospital leadership recognized the importance of a fair, reliable, and transparent pilot payment to the City of Boston. And we also acknowledge the importance of essential city services, police, fire, EMS, and others, that the city provides for the benefit of all, including large nonprofit organizations. We are proud to have paid more than $14 million in voluntary pilot payments since fiscal year 2012, along with providing community benefits for the City of Boston residents exceeding $30 million in that same time frame. As you all know, the healthcare environment is changing rapidly. And as we shift focus to keeping patients and communities healthier and reducing the need for expensive hospitalizations. To that end, both the Medical Center and the Baptists have been actively planning for our futures in the City of Boston through our value-based physician and hospital network and accountable care organization, the Beth Deaconess Care Organization, or BITCO, where BIDMC serves as the anchor academic medical institution to serve the most complex cases within our system. Through our work with BITCO, we partner with providers to improve quality of care while effectively managing medical expenses. And together, we have worked hard to maintain healthy and thriving organizations, not just within the City of Boston, but also within communities surrounding Boston, including Brockton, Cambridge, Everett, Lawrence, Milton, Needham, Plymouth, among others. While we've had some success, we recognize that to truly make a difference in the unacceptable growth in healthcare costs in the Commonwealth, we need to come together with complementary organizations that also are of lower cost and high quality. Together, we hope to create a comprehensive, geographically distributed, new, high-value healthcare system in Eastern Massachusetts. And I will now turn to my colleague David Spackman to further describe our goals and our efforts today.
Thank you.
Thank you, Stan. Thank you, counselors. It's an honor to be here. Thank you, members of the community who justifiably and understandably have concerns about their health care and their future. Should pay attention to these kinds of transactions because we all know we face huge, huge challenges in access and affordability of care in Massachusetts. And the more people that are interested in that, the better off we ultimately will be. I will confess I'm a little sobered by being here this morning because the last time I was in front of the Boston City Council was 1976. And Dapper O'Neill was sitting across from me, and I was actually there representing Boston City Hospital, the Department of Health and Hospitals, on a matter in which you did have jurisdiction. And he gave me a considerably hard time, and afterwards beckoned me over and said, "You did great." So I don't expect that kind of accolade afterwards, but it is a pleasure to be back here, and I guarantee I will not be back here 45 years from now. With that in mind, I want to talk a little bit about the goals and objectives of this system. Separately, each of our organizations, Stan has talked about Beth Israel, he's talked about New England Baptist. I represent Lahey Health System, and I would like to point out that Lahey Clinic, Dr. Lahey started at the Baptist, and there is a Lahey Clinic wing at the New England Baptist Hospital. So in some ways, we see this as a coming together of old friends. We are complementary systems. Giving up one's autonomy and becoming part of a much larger system is not always easy. BI and Lahey have been in discussions about this possibility for 3 years. All of us have been in discussions with others, too. But in the end, we had a complementary geography. Lahey and its community hospitals serve largely the northeast area of Massachusetts. BI and Baptist serve Boston and the southern communities largely. Mount Auburn is a major provider in Cambridge. So we have complementary geographies, and we had the opportunity to create a system that would cover eastern Massachusetts and provide all citizens of eastern Massachusetts access to a high-quality, very much lower-cost system. We actually we're not just being here to give you aspirations of what we might be able to do. Each of us has done it. Our community hospitals have thrived. Lahey Clinic Medical Center 5 years ago brought in Beverly Hospital and Addison Gilbert Hospital, then brought in Winchester Hospital. BI has brought in its 3 community hospitals. All of them, I would say, in sharp contrast to many community hospitals across this system, have thrived. We have pushed care to those hospitals. We have pushed specialties to those hospitals. We have made lower-cost health care accessible to communities in which people live, so they don't have to drive to the large, more expensive tertiary care settings. Lahey Medical Center is full. We are not seeking more patients for Lahey Medical Center. We move patients who agree and their doctors agree to local settings. BI is full. It does exactly the same thing. We survive and we provide high-quality care by moving care into the right place, the best quality clinical care at a significantly lower cost. And our lower cost and our lower TME has been documented over and over and over again. Again, this is not aspirational. This is what each of us have done. Separately, we've done it well. Together, we can do it much better. I could give you multiple examples, but I'll just pick a couple of them. Lahey Health System has one of the largest behavioral health divisions, corporations in the state. We even have a site in Boston. The fact that Beverly Hospital kept that going is a remarkable statement of community pride. We have kept it going. Think about what healthcare looks like now. What do we really know about healthcare? Mental health and behavioral issues skyrocket the cost of care. I don't even have to mention the opioid crisis. BI Caregroup does not have that capability. We will be able to share that capability across the system to better meet the needs that we know are there. Home care is another. Home care is far less expensive place to treat people. The faster you can go home, the better. I had hip surgery 4 years ago. I went home the next morning. I could have gone home that night, but that's because there were support systems at home. We will spread that throughout the system to significantly reduce price. The New England Baptist is the standard bearer for how to treat many orthopedic procedures. The doctors from New England Baptist are not going to suddenly go out, go up to the North Shore, the South Shore, but the standards they have developed over many, many years, which are recognized nationally as being state-of-the-art, we will be able to bring out to all of our orthopods and our orthopedic departments. Best practices can be spread throughout the system. And again, in the end, there are multiple examples of how we will be able to improve care, to reduce costs. I'm going to make a quick little sort of legal editorial because you will often hear that evidence suggests to you that when you get bigger, you get higher prices. And certainly we saw that example here in Massachusetts from the system that was created 20 years ago. There is no case, none in the country, of an organization getting larger in a marketplace when there is already a very dominant provider. None. There are no cases similar to like Massachusetts. We are the most highly transparent state in the country. I repeat that. We are the most highly transparent state in the country. All of our metrics, our costs, our TME, our services to populations, are reviewed and published every single year. The chances, and what we also know is we have a stack of papers this high that talks about what is wrong with our marketplace. 24 separate reports. I was helped author the first one from the Attorney General's office that talks about what's wrong with our marketplace and the disparity and the fact that too many people are treated in too high cost settings. So we know what's wrong with it. We know how to fix it. We will bring a competitive marketplace alternative. And again, we're not aspirational. We've done this over and over and over again by ourselves. We'll do better when we come together. A quick note about the regulatory process. We're being intensively reviewed by 4 separate agencies. This will be probably the most intensive review, clearly be the most intensive review of consolidation in Massachusetts. And it may well be the most intensive review of a consolidation in the country. We are being reviewed by the Department of Public Health. They gave unanimous approval. They believe us, but they have the right, if something comes up later in this process that they didn't take into account, to reopen it. They moved in accordance with the schedule that's required of them. But again, I emphasize they have the right to reopen this. We are being reviewed by the Health Policy Commission, which is unique to Massachusetts, and which is reviewing this thoroughly. We have the Attorney General's office with its antitrust and its consumer protection powers, in which I worked for 7 or 8 years. It is reviewing this thing intensively. The Federal Trade Commission is reviewing this intensively. We have produced over 20 million pieces of paper, interviews, emails, conversations, and it's ongoing. So anyone who's concerned that this is not, the tires are not going to be kicked on this, we're just hoping the tires don't explode from all the kicking. It's there. We're anxious and willing and open to going through this process. We welcome the review, although I will tell you at times it's rather painful. But it is happening, and there is not a stone that is going to be unturned. My final statement, and of course I will always be here to answer questions, is that when you look at the concern on the part of various communities as to whether this will impact their care, it will, for the better. We're going to be lower priced. We're going to be high quality. We are going to be able to connect their care through every portion of their trip through the medical system. We've done it before. We will do it again, but together we will do it better. Thank you. I appreciate the opportunity.
Good. Thank you, David. We've also been joined by my colleague, City Councilor Matt O'Malley, and I think we'll probably do Jane and Joanne, and then we'll go to the Community Health Center, so we'll stay with BIDMC. So you have the floor.
Good morning. Thank you for the opportunity to speak. My name is Joanne Pokaski, and I'm the Director of Workforce Development at Beth Israel Deaconess Medical Center, and I'm here to express my support for the proposed merger. I've worked for 13 years at Beth Israel Deaconess Medical Center, and in that time, I've developed a great appreciation for the commitment of all employees to excellent patient care and to improving the health of our community. One way that BIDMC supports the health of our community is by being a great employer. Our jobs start at $15, offer benefits, and are open to a broad spectrum of educational levels. We recently signed on as an employer champion in Mayor Walsh's Boston Hires campaign to assure that Boston residents connect to good jobs that pay well and offer benefits. We have a robust internal career mobility program inside the medical center. We regularly run pipeline programs to train our employees up into higher skilled jobs that we're having trouble filling. Over 150 employees have moved to new jobs as a result of these targeted programs. We're also very hands-on in supporting the careers of our employees. For the last 10 years, through our Employee Career Initiative, we've offered free pre-college courses in reading, English, and math to our employees, as well as free college-level science courses. We do a lot of support and advising for our employees, and their pass rates in these courses range from 83% to 98%. In addition, any employee can meet with a career counselor at the medical center and get some advice on moving their career forward. In 10 years, we've served 1,285 employees through this initiative. We also offer our employees free ESOL classes, a financial counseling program, tuition reimbursement, scholarships, computer classes, and citizenship classes. If you're a good worker who never got a college degree, Beth Israel Deaconess Medical Center is an excellent place to advance your education and build a career. Prior to working at BIDMC, I was the director of Boston Career Link, a one-stop career center in Roxbury. Working at the Career Center, I was frustrated how difficult it was to connect our job seekers to hospitals. Our job seekers would apply online, then hear nothing, and my team and I would try to call the hospitals, but our phone calls didn't get returned. When I came to BIDMC, one of my goals was to better connect community residents to BIDMC jobs. Now BIDMC actively partners with many Boston area community-based organizations that are interested in connecting their job seekers to opportunities at the medical center. We host about 20 internships a year from YMCA Training Inc., St. Mary's Center for Women and Children, Bunker Hill Community College, JVS, and the Hack Diversity Program. We also partner with about 15 organizations in Boston who refer about 100 job candidates to us annually, and we make sure we get a really warm referral for those candidates. BIDMC hires about over 40 summer high school interns a year into paid internships. And organizations who refer these young people to us include the Boston Private Industry Council, the John D. O'Brien School, ABCD Parker Hill, Bowdoin Street Community Health Center, the Mary Lyon Pilot High School in Boston, and others. We also host interns in the annual Job Shadow Day. So I'm proud of BIDMC's track record as a good employer, and the proposed merger is an important step for us in our efforts to maintain and enhance these critical programs. So thank you for your consideration.
Very good. Thank you, Joanna. Jane? Welcome, Jane Matlock.
Good morning.
Good morning.
Thank you, Councilor Flaherty and members of the Council, for the opportunity to be with you this morning to express my support for the efforts of Beth Israel Deaconess Medical Center and New England Baptist Hospital to create a new healthcare system in Massachusetts, along with Lahey Health, Mount Auburn Hospital, and Anna Jakes Hospital. My name is Jane Matlaw, and I am Director of Community Relations at Beth Israel Deaconess Medical Center. I've worked at the medical center for over 36 years, having started as a social worker, and I'm the beneficiary of upward mobility at the medical center, and I've been in this position now for 23 years. In my work at the medical center and out in the community, I have the privilege of working with over 60 community organizations in the Boston area. Last December, the Department of Public Health held a series of public hearings on the proposed new system, including one here in the city of Boston at Roxbury Community College. I'd like to share with you a list of those partners who came to the hearing and shared their reasons why they think that this new system will benefit their clients and the residents of the city of Boston. The letters are posted on the DPH website for the benefit of the public to see, and we have included a link in your package. So those organizations included the Greater Boston Food Bank, the Louis D. Brown Peace Institute, Jewish Vocational Services, the Boston Center for Independent Living, the Hyde Square Task Force, the Mass Immigrant and Refugee Advocacy Coalition, Healthcare Without Harm, the Brookline Public Health Department, and Jewish Community Housing for the Elderly. These are among the most respected leaders in Boston who care deeply about the clients that they serve. They want the highest quality of care, easy access, and options for care at a reasonable cost. Thank you for your time and attention to this important issue, and I too ask for your support.
Thank you very much, Shannon. We're going to shift to our community health centers. We love our community health centers in Boston. So, Philemon Laptiste, if you could introduce yourself for the record, and you have the floor.
Sure. Thank you. Good morning. My name is Philemon Laptiste, and I am the Executive Director of Bowdoin Street Health Center. First, I want to share with you my personal story on how I got to Bowdoin Street, and I'm going to tie it back to Beth Israel. So, I have 2 daughters, 12 and 6. I'm a lifelong resident of Bowdoin Street. Still live there with my family. And when my oldest daughter she had just turned 1, I got a call from my mom saying that she was sick. I left my job downtown and I came to my home, and my mom said, my aunt answered the door and said, "Your mom is not here. She took your daughter to Bowdoin Street." And I remember saying, "Why did you take her to Bowdoin Street? She's not even a patient there." So I get to Bowdoin Street and was greeted by the staff, explained my situation. My daughter's not a patient there, and I walked into one of the exam rooms. And I think that I can share that what I saw as a mom was any parent's worst nightmare, where you would see your child not really responding, very lethargic, and just moaning and crying, and just having turned 1, not able to explain or express what was happening to her. From there, we were rushed to Children's Hospital, and I remember being there and trying to explain to the attending physician what was happening or what had been shared with me, and then he stepped away and he took a phone call, and I'm thinking, I'm trying to explain to this man what's happening, and he walks away to take a phone call. But unbeknownst to me, that was Dr. Bonacci from Bowdoin Street calling to explain to him his assessment of my daughter. Later that night, I received a phone call at the nurse's station, and they asked me to, there was a call for you. Can you come out and take this call? And I did. And again, this was about 9:30 at night, and it was Dr. Bonacci calling to see if I was okay and if I understood what had happened with my daughter. It turns out that she ingested a small, tiny high blood pressure pill that had fell on the floor from my father by accident. I was looking for a new job opportunity several months later, and my friend said, check our website. I work for Beth Israel. You see what you find. And I said, no, I want to do meaningful community work. I don't want to work for a big or large organization. But I went anyway, and I saw a position for manager of community health at Bowdoin Street Health Center. And I remember thinking, oh my goodness, this can't be real. I called her, I said, you guys are affiliated with Bowdoin Street? And she says, yes, actually that's one of our departments. We have an affiliation with them. So I don't think it's by accident that I worked at Bowdoin Street. I do believe that it was fate that brought me there. Bowdoin Street was started many years ago, and when we actually did a survey with our community residents, what hospital would you like to be affiliated with, when we were looking for another hospital to partner with, the overwhelming majority said Beth Israel. We are a department of Beth Israel Deaconess Medical Center. We have access to the resources and services that are provided there. We have providers that come over, specialty providers like orthopedics, podiatry, optometry, that come over and treat our patients in Dorchester, in Bowdoin, Geneva, as opposed to them having to travel to go there. So this merger means a lot to us, because not only do we have patients that reside in the Bowdoin, Geneva area, there are many patients who may have lived there many years ago but have strong ties to the community that come back to Bowdoin Street because of their personal connection. I think that having the opportunity to go someplace that would be closer to them as a part of this merger, or as a result of this merger, would not only help with coordinated care, but for affordable care or to lower the total medical expenses for the entire organization. I thank you for having an opportunity for me to speak, and I'd be happy to take any questions at the end regarding our experience as a community health center with the organization.
Very good, thank you. And I see Nelson's here, very busy in your capacity, so if you could state your name and affiliation for the record, and you have the floor.
My name is Nelson Liu. I'm the board president for the South Cove Community Health Center. I want to thank the City Council and the community for the opportunity here to comment. I'm, as I said, the current board president. I've been a board member for 6 years now. South Cove Community Health Center has served the greater Boston and extending communities in Quincy and Malden soon, and Boston in particular for 45 years. We see 180 visits a year and have employed 300 plus staff locally at each of these locations from the community. Our relationship with BI-DMC goes back over 20 years, and that relationship has benefited our patients, our staff, and our overall organization. In particular for our patients, many of them who do not speak English fluently, nor in some cases, unfortunately, have the ability to pay for the care. I personally have what I would argue is a valuable family connection through my own care at times, through families who have had the birth of a child, and unfortunately the death of grandparents. In each of those cases, we've received the utmost, highest quality care from BI. And in none of these cases do they know who I am. It's all because we're just patients that they would afford the same amount of quality care regardless. South Cove believes that this merger is critical and essential to the financial well-being of not just BI, but the other institutions that it seeks to align itself with in this partnership. There are significant linguistic barriers throughout our community that we serve, but beyond, and I believe that this partnership will help to alleviate some of those concerns that our patients continually have in terms of their access to care. I appear before you here today on behalf of our board and our organization to offer our support, to wholeheartedly ask that you support this partnership, and I'm also here available to answer any questions that you may have in regards to our service at South Cove to the community.
Very good. Thank you, Nelson. Turn it over this time to lead sponsor, City Councilor Tim McCarthy, for questions.
Thank you all very much for being here. That was an incredibly in-depth synopsis of what you plan on doing. I certainly appreciate that. My questions were generally about the merger entity, and you answered that, Dr. Dave, to be honest with you, regarding prices doubling and tripling in other scenarios. I'm eager to hear, there was a press release that had that question or, stated as fact, which concerns me. But you addressed it very well. And with the health communities, community centers being here, that's very helpful as well. So I guess the real question I would have is, can you better explain to me just the costs and procedures that merged entities before they doubled and tripled in prices? How does your merger differ from the previous merger years ago?
I'd be glad to. Having been intimately involved in just that question for the last 8 or 9 years, during my 4 to 5 years, it's hard to remember now, years at the AG's office, that was a very significant part of what the Attorney General was looking at and why we had such widely differing prices, where the largest entity that was 5 times the size, I don't use names, of any other system in Massachusetts had prices that were 30, 40, sometimes 50% higher than everyone else. And it was through the efforts of the Attorney General's office where it became very clear that those prices differed not because of quality, but because of simply size, that they were the largest and sort of had-to organization. That has been confirmed in 24 separate reports, sometimes reports on reports, over the last 7 or 8 years. It was confirmed by the legislature's unwarranted price variation commission. So we know why we have that price variation. We also know why we have such high prices. We put people in tertiary, quaternary institutions at sometimes 2 to 3 times the national average when you look at Medicare results. Too much care goes into our very high-priced academic medical centers, which provide great research, great care, bulk of our communities. No criticism there, but we put too much care into those facilities. So in that sense, when I look at what we are doing and why we will be different, number one, remember the price increases that one system was able to extract from the marketplace occurred when there was virtually no oversight. There was virtually no even understanding of what that meant. That oversight did not start until the last 5 to 8 years when we began to identify what the problem was. We created the Health Policy Commission, we created benchmarks, and we began to report on an annual basis virtually every metric about our providers and our physician groups and where they stand with respect to quality, where they stand with respect to price, where they stand with respect to TME. We have more information than any marketplace has ever had. Our ability to actually, even if we wanted to, extract a supra-market increase, in other words, an increase beyond what others are getting, simply because we've come together, is, in my own humble opinion, although I'm not very humble, zero. Because it's going to be everywhere. We're going to see it a year or two later, and if suddenly the pattern is we're going up, we'll be called to task. But it's not going to happen. I would also state that we're trying to bring true competition to Massachusetts. There is none. We do not have a competitive marketplace. That's been documented over and over again. No one is able to mount a competitive challenge to that system that will not be named. We will, for the first time, will be able to create that. We have not fixed our problem by legislation. We have not fixed our problem by law enforcement. The only way we're going to fix our problem to have price and quality actually be a competitive part of the marketplace, where we can begin to put challenges to those who have high prices, where we can get to a point where insurance companies will offer products to families based upon the provider they choose. Right now, high-value providers, those with high costs and high quality, they're the low-value providers, high costs and high quality, basically are being supported and subsidized through the insurance company by those of us who choose high-value providers, low cost, same high quality. We have so many problems with our medical system. We have great care, but the price is a real problem, and where you get the care is a real problem. Price, TME, is quite bluntly our market advantage. It's good for the Commonwealth. It's good for our patients. But, it's also good for us. It allows us to be an effective competitor. I hope that answers your question, and I'm happy to answer any follow-ups up if I've gone too far.
No, absolutely no. I appreciate your thoroughness. My last question, because I want to be respectful of everybody's time. The Medicaid patients in particular, what is the positive or negative effect this could have on Medicaid patients?
Every population will have a positive effect. Medicaid patients want high-quality clinical care. They want care that is not fragmented, where their doctors aren't talking to their other doctors. They want to be part of a system where their medical record follows them, where their care follows them, and indirectly, they want lower-cost care, because to the extent to which we can bring costs down across the Commonwealth, their possibilities of access will increase. So from my perspective, every population, including Medicare, Medicaid, disadvantaged, et cetera, their care and the quality of their care and the cost will be enhanced by our coming together and being a stronger system.
Thank you very much. Thank you, Mr. Chair.
And David, stay on that, on the metrics piece. So the volume of metrics, I assume you've seen increase over your time. Does it become sort of cumbersome and burdensome, and does that add cost in some respects?
Well, at times, first of all, yes, there were no metrics when I started. We typed on a manual typewriter. The metrics we have now are startling. Gathering the metrics is not all that complicated. The advantage we have now with electronic medical records, with computer technology, means that we all know at this point, medicine's no longer an art, it's a science. Our ability to know what the right standards of care are, to know what works, to allow a patient to move through a system and have the medical record follow them, to allow organizations like CHIA, which is our data mine here in Massachusetts, to extract from providers and from payers the kind of data that we normally produce anyway, to be able to compare our performance against the neighbor's performance, against Western Massachusetts and Southern Massachusetts, big systems, small systems. Wouldn't have even been in my dreams 45 years ago, when I was less than 45. So, we are in a position where the spotlight on what we do now, what we will do in the future, is beyond anything we have ever experienced before, and certainly did not exist when the first megasystem was created, 25 years ago here in Massachusetts. So you will know when this comes together, this will be the most thoroughly documented case of what happens when you create a legitimate competitor in a market that's already dominated. You will know, has it impacted our payer mix? Has it impacted our prices? Has it impacted our TME? Has it impacted our ability to provide services to disadvantaged? Has it impacted our ability to provide mental health services? We're going to have a scorecard that's longer than anything any of us ever saw in school, and it's going to be with us for the foreseeable future and beyond.
So it's a test case.
Yes.
Councilor Flynn?
Thank you, Councilor Flaherty, and thank you, Councilor. I understand part of the reason for merging is to save costs through efficiencies, reduced administrative costs. How will this impact staffing with this merger? Do you envision laying anybody off? I also see, just in my own experience, dealing with healthcare, is the courageous professional job of our nurses across the state. They do an excellent job. They're practically unsung heroes in the medical field. What will happen to our nurses or other workers during these mergers?
The answer to that is we've made no plans for any layoffs, but there were not going to be any layoffs when the people who touch patients, the people who issue bills, the people who clean, the people who monitor compliance. You have to remember, this is not a merger of two institutions that sit across the street from each other. These are two geographic areas. The only areas in which any efficiencies may come from staff decisions are at my level, at the CEO level, at the very top end of the executive suite. That is where you may see some personnel changes. But at the staff delivery level, in the hospitals, and those who issue the bills, and those who monitor performance, there's not going to be any impact on staffing and personnel or employment. None.
No.
And Stan, please talk.
No nurses will be laid off.
On the contrary, I think it's clear from what you're hearing that we expect to grow. We expect to expand services. We've demonstrated that as two legacy organizations already. I think the track record speaks for itself, and we fully anticipate that to be the outcome of successfully executing on what we are proposing. So this is not a strategy of shrinkage. This is a strategy where we expect to see expanded capabilities and resources in our communities.
I would also add, if you know any nurses looking for a job, please send them to us, because they're in short supply and we're always looking.
In the past, any mergers from Lahey or BI acquisitions, such as Winchester Hospital, did prices go up or prices go down during that period of time?
No. Our systems have been documented. It's all in the public record, of remaining very high high-value, low-priced providers in the marketplace compared to our to the rest of the marketplace and our peers.
What impact will this have on, I know you mentioned some community health centers across the city. What impact will this specifically have on other community health centers that you didn't mention?
That we didn't mention. For whatever we didn't mention, the answer is no. We don't have a community health center, for instance, in Gloucester, but the programs that we have built out in Gloucester have been documented over and over again. That is a small community hospital that serves a limited population on what they always acknowledge as an island. Addison Gilbert had been rumored to close for 20 years. It is now flourishing. It has higher volumes than it's ever had before. It's financially stable. We have opened up clinics, drug programs. 97% of the people who come to our emergency room can now actually be treated on Cape Ann. So again, for every community health center, every community program, this combination will enhance the strength of the system and enhance the ability of us to deliver those kinds of services that are out of the hospital but are critical to our population's health. And remember, again, we do this for ethical reasons because we're mission delivered. But as we move more and more into population health, where we're not paid on a fee-for-service basis, we're paid on our ability to keep people healthy, those programs are essential. So we do it because it's our mission, and we do it because it's good business, and sometimes you can trust good business more than mission. So I think we have a dual reason for continuing to do that, and we'll do it much better.
And I represent a district with a high concentration, communities of color, elderly, the disabled, immigrants. What type of impact will this have on the most vulnerable people in our society?
I'm going to let Stan answer that question.
I think the impact on the most vulnerable will be similar to the impact across the board. We expect that the outcome of what we are creating here will be the ability to deploy more resources, expand access, create more availability in terms of specialty services in local communities. So we would fully anticipate the impact to be a very positive one.
Thank you.
Thank you, Dr. Chair. Recognizes City Councilor Ayanna Pressley.
Thank you, Mr. Chairman, and several of my questions were asked and answered relative to the impact on neighborhood and community-based health centers, and also the impact on traditionally underserved communities. I did just want to revisit a couple of things. Could we just drill down a little bit more on workforce? I'm curious as to how many people you actually employ. If you have any sense as to that, I'm just curious, as an employer, and appreciate your verbally expressed commitment here around workforce retention, because I'd imagine that many of these employees have been of service and giving of themselves for many, many years. And so not only do we want to make sure that they're still able to provide for their families, we certainly don't want the quality of care to be impacted. And so also picking up on Councilor Flynn's point, which was also a question of mine, we know that there is a nursing staffing shortage crisis. And not only is that a burden on our already overextended and dedicated nursing staff, but also does impact the quality of patient care. So when you say you're looking for more, I'd be curious as to sort of where we are in terms of nurse-to-patient ratio, and how we'll make sure that's still one that is fair for the workforce and also meeting the needs of patients. So those are my two questions before I get into a Medicaid question.
Well, I'll just reiterate the statistic I shared in my earlier comments, that the total employee base between the medical center and the Baptist is over 11,000 people, of whom about a third live within the city of Boston.
Okay, wonderful. Thank you. I'm sorry I missed that point earlier. And again, thank you for your commitment to retain them. We always worry about layoffs and these sorts of mergers. Okay. And then on the nursing side, is there any statistics that you could share, sort of in the aggregate, or no? Just lumped in? Okay.
I don't have that.
Okay. All right.
I know that we provide high-quality care. We value our nurses, and we're always looking for more. So, but I mean, we're very comfortable with our clinical care. I think we've, no one has ever disagreed that our care is not high quality, and it's been showed by patient satisfaction statistics over and over again. And nurses are largely part of your patient satisfaction
Absolutely.
statistics.
Okay. And then on the Medicaid side, I just didn't know if previously there are specific strategies or something that you might point to so far as increasing access to those regardless of their insurance status. It's not something that just happens by default or organically. Are there best practices or strategies that you've used in order to increase access to Medicaid users?
I think probably the best example of that is our partnership with our community health centers, the fact that the medical center itself serves as the community hospital for a very diverse population within our own communities. We continue to strive to provide comprehensive services to all, and we'll continue to do so and commit to do so. As a corollary for what it's a slightly different approach, but certainly we are also active participants in the new Medicaid ACO program within the state with many of our partnering organizations.
Okay,
as well.
appreciate your stating that for the record officially.
And I would add that Lahey separately is also a member, one of the smallest members, but we are a member in that new program, which is another experiment that we think makes sense and we all hope will be successful.
I would just add, because we sometimes don't recognize this, but in some of our community affiliates, including places like BID Plymouth, there's also significant Medicaid populations. And I think, as is the theme throughout our presentation, we have a great track record. It's great when the facts are on your side of deploying resources, of building new services,
Okay.
of creating access to that population, which is quite significant in that region.
Okay, great. Appreciate the intentionality. All right. Thank you.
Thank you. We've also been joined by my colleague, City Councilor Anissa Asabi-George. Any questions of this panel at this time? Very good. So that'll conclude the first panel. Let me just say that, as a city, we boast of having the best hospitals and network of community health centers in the world. You're our largest employers, you're leaders of strategic partnerships, and you're our neighbors. So we appreciate your time and attention this morning and look forward to continued working together. So appreciate your time.
Thank you very much.
Thank you. And I see that Dr. Wagner, CEO of Tufts Medical Center, is here. If Dr. Wagner could come down, and I don't know whether or not if Howard Grant and or Ralph Delatoria are here yet. If so, they can join Dr. Wagner, and if not, then welcome, Dr. Wagner. It's great to see you. So, welcome, Doctor. If you can state your name and affiliation for the record, and then you have the floor to discuss this matter.
Thank you. Good morning, councilors, and thank you for the opportunity to testify this morning and taking time to ensure there is greater transparency around a proposed healthcare merger that will have a very large impact for the city of Boston and the entire state. My name is Dr. Michael Wagner. I'm the CEO of Tufts Medical Center and the Floating Hospital for Children. Our hospitals are part of a larger system called WellForce that includes physicians and hospitals in Boston, Lowell, Melrose, Medford, and other vital communities throughout eastern Massachusetts. Our system has been recognized for its commitment to keep care local and providing the highest quality of care at lower cost. Our essential role in the marketplace has been recognized by the Globe, the Attorney General, Health Policy Commission, and others. We are committed to improving the health care of diverse and underserved communities in Boston and Massachusetts. I'm here today to express my deep concern over the proposed merger between Beth Israel Deaconess and Lahey Health. I have great respect for these two organizations, but I have grave concerns about what the merger of these two systems could do to healthcare costs and access in Boston and eastern Massachusetts. My concerns are that this merger will result in increased disparities, increased costs, while reducing access, especially for underserved communities. Let me first discuss the impact on disparities. The proposed merger will essentially create two large systems, a duopoly, in which 54% of the commercial healthcare volume in the state would exist within these two mega systems. A merged BI Lahey system which has selected partners from largely more affluent Massachusetts communities, would have the lowest percentage of Medicaid care of any system in eastern Massachusetts, just 14%. 14%. By contrast, the welfare system is 21%. Tufts, 31% of our patients walking into our doors and being admitted to our hospital are Mass Health patients. 66% of the kids we care for are Mass Health Medicaid kids. Why is this important? This merger would widen the disparities by creating a two-tier system. Those who are focused on the commercial population, partners in the merged BI Lahey system, and those who have a disproportionate share of Mass Health patients, our state's most vulnerable population. The have-nots systems would not receive the adequate reimbursement to compete with hospitals who have chosen to focus on more affluent and commercially insured patients. Unlike the argument used by these systems in the past, providers such as Wellforce and Tufts and the floating do actually use commercial reimbursement to cross-subsidize our higher proportion of Medicaid care and costs. Additionally, hospitals such as Tufts Medical Center and the Wellforce sister organizations, along with many other hospitals who are not part of either of these systems, are high Medicaid providers, and as of March 1st, are now participating in the state's Mass Health ACO that was mentioned earlier. This scenario creates a situation in which the hospitals with the greatest risk exposure in the Mass Health ACO also have the least opportunity to cross-subsidize from commercial payment. Add on top of this an already existing price disparity that was talked about earlier, where high Medicaid hospitals have lower commercial reimbursement, thus creating a double jeopardy for our safety net system of care for the poor and underserved. In human terms, this means disparities across Massachusetts will be exacerbated. The second piece I would like to discuss is the argument that this new system would create a competitor to partners. It follows from the assertion that the new system would take patients from partners, and since partners is a higher paid provider, this movement would reduce healthcare costs. However, this is a false argument. The new combined Beth Israel Lahey system would likely siphon the remaining commercial patients from non-partners hospitals, community health centers, and physicians. This possibility is more likely to occur than the argument being proposed that they will move market share from partners. The shift of patients from high Medicaid hospitals and providers to the new combined BI Lahey system will actually increase costs due to the price disparity that exists between the proposed merged entities and those who are high Medicaid providers, who are lower paid, thus destabilizing the healthcare providers serving the most vulnerable populations. The last piece I want to bring to your attention is the likely impact on price disparities. The current pricing disparities, which were again mentioned earlier by Mr. Spackman, in the eastern Massachusetts have been well outlined by the Globe, the AG's office, HPC, and CHIA. In fact, David Spackman played a key role in helping to bring this to light. There has not been any movement to change the reality of those pricing disparities, however. The question we should be asking is, what is the impact of this newly combined BI Lahey system on pricing in the marketplace? Will the new system remain where they are? Will they reduce their price because they're able to deliver synergistic savings? Or will they increase pricing due to their increased leverage in the marketplace? The evidence from other markets is that prices will increase. The BI Lahey system will ultimately move their pricing to approximate the market leader partners. Currently, there are no restrictions in the merged entity's ability to raise their prices. My expectation is, as stewards of the healthcare environment that affects Boston businesses and families, that you will use your council position to advocate for conditions on this merger. These entities should commit to specific cost controls for both unit-based pricing and total medical expense. Why do I feel strongly that the newly created BI Lahey system will raise prices to approximate or come close to partners' price structure? Because as BI Lahey, which they talked about, looks to grow, they will need to recruit physicians. If they are paid below partners' rates, they will not be able to attract new physicians to satisfy their growth plans. Both partners and the newly formed BI Lahey system will have an aggressive growth plans, and in order for them to recruit physicians, their prices will need to be comparable. Make no mistake, when they grow, they will focus on moving commercial patients from non-partners and non-BI Lahey systems and providers. So I think it's important to ask, how is this merger good for our community? How will this merger actually reduce healthcare costs for the residents and businesses of Boston? What protections can be put in place to ensure costs don't increase and for consumers and services for low-income communities especially aren't jeopardized? At Tufts, we care deeply about our commitments and the communities that we serve. Our commitment is to keep our healthcare in the community, especially lower income and underserved communities. Thank you for the opportunity to testify, and willing to take any questions.
Good. Thank you very much, Dr. Wagner. Chair recognizes Councilor McCarthy. Any questions of Dr. Wagner?
Thank you very much, Dr. Wagner, for being here. Just a quick question. As far as the merger, when the merger was taking place, or the talks of, was Tufts involved at all? Did you think that, like, would you have gotten in the merger if they had asked you?
So I'll answer the first part, which was, were we included in the conversation? The answer was no.
No. And if they had reached out to you, you think Tufts would be, you think you would have been on the first panel or the second panel?
So one of the things that I think is important to say, and David mentioned this, is that I think all systems end up talking to each other at some point around potential discussions and mergers. As it was well publicized that Tufts and BMC were in merger conversations in 2015. To say that organizations are in some form of informal or formal conversations, it happens all the time. But this specifically, we weren't involved in the conversation.
Okay. So in the conversation in 2015, would you agree or disagree that your opinion of the outcomes would be the same or different? How would you do it differently, I guess, is the question I'd ask.
With regard to the discussion with BMC?
Right.
I think that the conversations with BMC were incredibly productive. It wasn't strategically correct at the time, and we both realized that and decided not to pursue further discussions.
Okay. Thank you very much, Mr. Chair.
And then, Doctor, with respect to, you had mentioned conditions, so if this merger would go through, the conditions that you would think would be necessary, could you just highlight them again?
Yeah, so sure. So one is clearly around pricing and pricing structure. We do have a pricing disparity issue in the marketplace. It does create a very uneven playing field, and it also creates a situation in which those hospitals, as I mentioned, have very high mass health populations, are in a more vulnerable position, especially as they take on more risk in the mass health ACO. So pricing, I think, is very important, and that's important for our employers and those who are paying for health care. In terms of, from a conditional perspective, I think other things to look at is the affiliation in flow and connection with relationship to doctors, physicians in these mergers, and it's oftentimes overlooked to also consider what number of physicians, where they're located, and how they are aligned with the health system. I think this is a very important component. Certainly, capping the growth in number of physicians or looking carefully at physician groups being included in this merger should be specifically addressed as well. And then lastly, I think, from a conditional perspective, the impact that I think about a lot is around access to key services, pediatrics, behavioral health in communities like Lawrence, Brockton. We do a lot of work in pediatrics in communities in mostly underserved areas. Is how are we as a Commonwealth going to assess the potential negative impact as services in those communities may be negatively impacted by the financial performance of the pillar organizations that are left alone or left standing alone.
Thank you. Councilor Flynn. We've also been joined by City Council President Andrea Campbell.
Thank you, Council Flaherty and Council McCarthy. Thank you, Doctor. And as you know, Tufts Medical Center is in my district. I am concerned about jobs. If this merger is allowed to go through, how do you believe it will impact Tufts Medical Center's ability to compete? And could it ultimately impact the number of jobs at Tufts?
Yeah, there are many. So first of all, I'll make a comment. Many of the healthcare organizations in the city made a commitment around a 15-hour living wage. And as was mentioned, BI made that commitment, and as BMC and Tufts also made that commitment. Our workforce, we have 5,500 employees. We have another 600 physicians that work out of our downtown campus. And we've worked hard to grow. We've actually added probably somewhere around 600 jobs over the last several years because we've had an aggressive growth plan like all health organizations. I worry about our ability to continue to provide services in pediatrics in the community, which would have a downtown impact in terms of our pediatric enterprise. I do worry about our ability to continue to recruit physicians and do it effectively, as my earlier comment regarding physician recruitment. Our growth, we've grown aggressively and taken advantage of the fact that we are the smallest academic medical center in town. We're not looking to fill beds. We actually work collaboratively with Lowell General and with Hallmark in increasing their care in the community. We'll continue on that strategy, and it's certainly my hope that we will work very hard to prevent any job losses.
Yeah, Doctor, as it relates to underserved patients, communities of color, the elderly, immigrants, low-income families, those without health insurance, what impact or potential would this have on that segment of society?
Yeah. So what I worry about is, and it's, you know, maybe I'm too concerned about this, but what I worry about is that we will more than likely see hospital closures. We saw it in North Adams, we saw it in Quincy, and the question is if we see further hospital closures because of a reduction in inpatient utilization and consolidation, if the consolidation is predominantly focused around commercially more affluent communities, and those that are in high Medicaid, mass health communities are excluded or disadvantaged in the marketplace, those are the hospitals that are at greatest risk. And I'm not going to go through my list of the hospitals I worry about, but they're hospitals that we work with on a regular basis. The devastating impact, not only for the access to care, behavioral health services, primary care, but also the job losses that would occur in those communities are not insignificant. So that's the scenario that I think about a lot in terms of what we can do from a policy perspective to ensure that those hospitals remain viable and important pillars of employment and care delivery. Is that helpful?
Yes, it is. And just one final observation is I'm at the hospital at least once a week, and I see the dedicated workers up front. I especially see the dedicated nurses working so hard, so professional, determined, compassionate. We're really lucky in this state to have some of the best nurses around, and you know, it's a testament to all of our hospitals. These nurses really provide an exceptional quality in making sure our patients are safe. And you know, I think we need to always do more for our nurses to make sure that they're always treated with respect and dignity.
Thank you. Agreed completely.
Chair recognizes the City Council President Andrea Campbell. No questions at this point. So, Doctor, thank you for your time and attention and for the great work that you do, as well as the great care that your hospital, your doctors and nurses provide, as well as your staff, your community relations and government affairs folks are a pleasure to work with. So it's always good to see you.
Thank you, Councilor Flaherty.
Now call upon Hanai Reyes, Tim Foley, Bonnie Gilbert, James Jennings, and David Cutler to serve as our next panel. Hanoi Reyes, Tim Foley, Bonnie Gilbert, James Jennings, and Dave Cutler. Come on down. I don't see Tim Foley's Tim. I don't see him here. I don't see Tim, and I don't see James. So, welcome everybody. Okay, very good. So, whoever you want to start with, that'd be great.
Absolutely.
That'd be great.
Good morning.
Welcome.
My name is Hanoi Reyes, and I am a resident of Jamaica Plain. I'm also a spokeswoman for the Make Healthcare Affordable Coalition. I want to start by thanking the Boston City Council. I want to particularly Councilor McCarthy and Flynn for calling the petition for this hearing today, which is very critical for our communities. So I want to start by saying that and emphasizing that I am not a healthcare specialist. I am here representing the over 60 diverse community members, leaders, and representatives of the communities I serve, which is across Eastern Massachusetts, who have grave concerns about the 13 hospital mega merger led by Beth Israel and Lahey Health. Many of our members are here today behind me and sitting in white t-shirts and others which are not. This mega merger represents the biggest change in our healthcare system in a generation, according to the Massachusetts Health Policy Commission. It will impact more than 1 million patients across Eastern Massachusetts, including those who rely on community hospitals in Boston's diverse neighborhoods. The track record shows that these hospitals do not serve our poorest communities. By joining together, they are forming a second Goliath in the market. It is clear that it will leave the remaining hospitals that serve our poorest communities further behind. So I want to ask, why will we do this now when our disparities in the healthcare system are already so great? If approved, the merger will lead to higher costs and reduced access for working class and especially the communities of color. Eventually, community hospitals that cannot complete will have to close. This is based on a research conducted by Dr. James Jennings of Tufts University and published at the Boston Globe. Here are some figures to keep in mind. The mega merger will control 1 in 3 hospitals. It will control 1 out of 3 primary care visits in Eastern Massachusetts. Every study has shown that as providers gain market power, costs have increased. The merger will target affluent households of income of over $112,000 a year, while low-income and mass health patients will be left behind. To further demonstrate this, in 2016, only 10% of Lahey's patients were on Mass Health, and 18% for Beth Israel. This compares to the 31% of Tufts patients and 51% of Boston Medical Center patients, which are on Mass Health. Boston community hospitals outside the mega merger like Tufts, BMC, and Kearney will not be able to compete and will ultimately be forced to reduce their services and close. People of color in the working class could lose their doctors, be forced to travel long distances for services, and pay more for healthcare premiums if the merger is approved. We believe the state's Department of Public Health acted prematurely in issuing its approval of the merger last week before the HPC's cost impact review was completed and reported. Again, I thank the City Hall for bringing this merger process out of the darkness and into the light. And I urge you to take the next step and ask Attorney General Mara Healey and the HPC to fully investigate the impacts of this merger before it is too late. Thank you. And I'll be happy to take any questions.
Great. Thank you, Hanoi. Lonnie. Great to see you.
Okay. Sorry, I'm just
Okay, we
getting, well, not really. Okay. Can you hear me?
Yes, we can hear you.
All right. Good morning, Boston City Council members. My name is Bonnie Gilbert, and thank you for allowing me to address you on this issue. I am a strategy team member of the Greater Boston Interfaith Organization, GBIO, which has over 40 member congregations, many of which you probably know are right here in Boston. I am chair of the GBIO healthcare team, and I'm a member of the 10 taxpayer group, Go Teach. I'm involved in this issue and am here today because I am not also a member of the healthcare industry, but I, like many other Massachusetts citizens, have had our family's health care costs escalated to outrageous levels. We are a family of 5, and although there are no life-threatening issues, health issues in my family, we have a number of chronic health care issues. So we are paying now close to $25,000 a year between copays, deductibles, premiums, and other non-covered expenses. And frankly, I would challenge everyone here to go home and tally up your medical expenses and see where they have gotten to and how much they've grown in these last few years. So GBIO's position is that we're not necessarily opposed to the merger, but we are deeply concerned with the same 2 issues that are being presented here. 1, the impact on other community providers, and 2, the impact on costs. We oppose any merger that does not include strict conditions preventing higher costs and prices, and which does not include substantial consequences for a failure to do so. We testified last week in front of the Public Health Council that we were distressed to see that the Determination of Need Department had removed the only condition in their staff report that directly addressed cost increases. The original condition was removed at the last moment prior to any or after any opportunity for any public comment. That condition had required NUCO to ensure that the health status adjusted total medical expense of the NUCO system did not exceed the health care cost growth benchmark of any calendar year, which is currently now 3.1%. Now, this condition was not the sole solution to the problem. To the contrary, we consider this condition to be the bare minimum first step. But it was removed and replaced by a condition that 1 will only be triggered at the discretion of the Health Policy Commission, that 2 does not have any significant enforceable consequences, and 3 is more of a reporting condition rather than a specific limit on costs and prices. So what is our bottom line? We recognize that NUCO's assertions throughout its applications and in its testimony today that its intention is to provide high-quality care at a lower societal cost. And we applaud these intentions. And this, as I said, is exactly what Attorney Spackman spoke of. And if they're right, it's a win-win for everyone. But if they're wrong, they win, and we, the Massachusetts citizens, lose. So we assert that Massachusetts citizens cannot afford to allow any more mergers solely on the basis of well-intended yet unaccountable goal statements. Our government, all branches of our government, have a responsibility to do whatever each can to require that if this merger does take place, that it will live up to its goals. So we urge you, the Boston City Council, to strongly advocate to the Attorney General and to the Health Policy Commission that if this merger does go forward, and it has not been permanently approved, it is a tentative conditional approval at this time, that if it is to go forward, it must be encumbered by strong conditions that will explicitly require caps on increases in costs and prices, that will require documentation of compliance so that there can be an accurate review, and will contain clear and substantial consequences for failure to meet the conditions. We thank you for your time and consideration of this request.
Thank you very much, Bonnie. And Elizabeth Daly, welcome.
Thank you. Good morning, councilors. My name is Elizabeth L. Daly, and I'm a lead researcher for 1199 SEIU, United Healthcare Workers East. Thank you for this opportunity to offer testimony today on behalf of 1199 SEIU and the 1199 SEIU 10 taxpayer group that was established to offer public comment on the proposed 13 hospital merger that is the subject of today's hearing. As you may know, 1199 SEIU represents more than 56,000 individuals employed in Massachusetts hospitals, in nursing homes, and who provide home care. Workers at what is now Beth Israel Deaconess Plymouth Hospital have been part of our union for more than 45 years. We offer this testimony today on behalf of those BID Plymouth members and on behalf of all our members as both frontline caregivers and as Massachusetts consumers of health care. 1199 SEIU formed our TTG in September of 2017 after the merger application was filed with the Determination of Need program of the Department of Public Health. We attended all 3 of the DPH public hearings on the matter and submitted written comments. 1199 SEIU Acting Executive Vice President Tim Foley is also privileged to hold a seat on the Health Policy Commission, which is conducting a full cost and market impact review of the proposed merger. And we will continue to weigh in on this issue through that process. Like others here today, we're very concerned about rapidly increasing healthcare costs. Just about all research indicates that hospital mergers result in higher prices and costs for consumers, insurers, the state, municipalities, and other payers. We remain very skeptical that the conditions imposed on this merger by the state DPH will provide adequate protection for consumers. Secondly, we're concerned that the merged entity, currently being referred to as NewCo, will result in a loss of transparency and accountability due to the consolidated filing of financial documents. Accordingly, we seek a requirement that the merging entity file provider-level, as opposed to system-level, financial reports. Next, we're very concerned about the health of community hospitals that will be impacted by this merger, particularly those hospitals on the North Shore and in the Merrimack Valley, and Boston's disproportionate share of hospitals. The new co-entity has the potential to draw commercial payments away from competing hospitals, potentially harming these competitors enough that it may result in loss of services and loss of healthcare access for their patients and their communities. At the same time, we're also concerned about the smallest community hospitals involved in this transaction. We know from experience that it's often the smallest and weakest hospitals in an integrated health system that bear the brunt of service cuts. We have requested that, if granted, final approval of the merger include a requirement to keep both Addison Gilbert and Anna Jakes open as full-service acute hospitals for a minimum of 5 years. Finally, we remain very concerned that almost no structures are in place to adequately engage the thousands of staff at the merging hospitals in the merger transition and the company restructuring. At BID Plymouth, where 1199 SEIU represents more than 1,000 workers in departments across the hospital, and the Mass Nurses Association represents RNs, the union difference is clear. When business decisions are made that might result in a reorganization or reduction in staff, workers are involved in seeking appropriate solutions that minimize disruptions in care. When workers must be laid off, there are orderly and fair processes in place. Moreover, at BID Plymouth, 1199 SEIU and management meet monthly to discuss ongoing issues of mutual interest. For example, our members have recently started a series of monthly meetings with the hospital's CEO and chief of nursing to identify and collaborate on a range of projects intended to improve the patient experience. Because such collaborative structures exist at this single hospital among the 13, workers are empowered to speak up on behalf of themselves and on behalf of patients. And the hospital has recognized that the workers who are doing the frontline work every day are valuable partners. It is essential that workers at all levels of an organization can voice concerns about best practices for patient care and for workplace safety. Workers should be assured of an orderly and fair process for training opportunities, overtime, pay increases, promotions, and/or for any reductions in staff. New job descriptions, staffing allocations, or work expectations should be developed in close collaboration with the entire frontline workforce. Over the years, we have seen too many instances of management and hospital human resource departments protecting the company and not the workers who bring the problems to light. 1199 SEIU cannot support the proposed merger without some formal structures and processes in place throughout the NewCo facilities that will foster a true culture of employee engagement and support. We commend the Boston City Council for your interest in the proposed merger and for holding this important public hearing today to hear from a range of stakeholders about the potential impact on healthcare in the city of Boston. Thank you for hearing our concerns, and I'm happy to answer any questions you might have.
Good, thank you. Elizabeth, Chair recognizes Councilor McCarthy for this panel. Questions?
Yes, thank you very much. Thank you very much for taking your time and being here today. Quick question, I'm not sure who can answer it. I'm guessing Bonnie maybe, I'm not sure. As far as the restrictions, when you go before the Public Health Committee, who puts those restrictions on? Can they add that or subtract that to the merger, or is the merger as is?
So the department, the determination of need department staff reviews the application, creates a report that includes the conditions that they recommend be put upon the merger. They put that report out to the general public for comments, and then that report is accepted or not by the Public Health Council. In this case, it was amended 3 days prior to the vote, after the period for public commentary was closed. So one of the conditions that was in the original report was removed and a different condition put in its place. Now, after that vote, now the HPC will come out with its report and make its recommendation to the commissioner, and then the commissioner will have the discretion to add or change conditions. It does not necessarily go back for another vote.
Okay, and the condition that was removed was caps on cost?
It was a condition, the original condition number 4. And what it did is it held NUCO to the cost benchmark. So it's the growth in cost that is determined each year. It's slightly below the inflation rate. So this year was supposed to be 3.1%. So it's not even the strongest condition that we would like to see, but it was the only condition that did put some restrictions on costs, and that did require NUCO to provide documentation to ensure that it was meeting that requirement.
Thank you very much.
You're very welcome.
Councilor Flynn.
Thank you, Councilor Flaherty, and thank you, Councilor McCarthy, as well. A quick question for Elizabeth. I know you highlighted the frontline workers, 1199, the Mass Nurses Association as well. I know you both do tremendous work in interacting with the patients. Are you afraid if a merger takes place that some of that hands-on personal contact we have between our nurses and other healthcare people will lose some of that compassion, will lose some of that interaction, because now we're dealing with a bigger company, and that may not be focused on the day-to-day or interaction between the patient and the provider?
Indeed, I think there's tremendous pressure throughout the market to keep costs under control, and I think too often when workers don't have adequate representation or a voice on the job, too often the brunt of those cost controls are borne by the frontline caregivers. And so that can create instances where patient care is less than ideal.
Thank you, and I just want to say thank you for what 1199 has done for so many years across the state and providing great, compassionate care to so many people.
Thank you.
Thank you, Councilor Flynn. And Hono, your organization, so have you guys weighed in through the comment period?
Yes. So, sorry. We have participated, and we were part of the whole process with the public hearings, which were assessed in, there were 3 public hearings, were in Gloucester, in Cape Ann, and one in Roxbury, both held at 5 p.m., where many of our grassroots members were coming out of work and working and picking up their kids. So that's why they're here today, because they wanted to make a statement that, they want to be part of the conversation. You may have, they're obviously collaborating with other organizations, but the roots themselves, the residents, we wanted the residents themselves to be part of the conversation, which they were not.
Very good. Well, thank you, folks, for taking time to be here in the panel. We're going to now continue with public testimony. so I appreciate your time and attention this
Thank
morning.
you.
Thank you.
I'm going to call, and if there are folks here that are wishing to offer public testimony, there are sign-up sheets over there on, to my left, to everyone's right. But we'll start with Isabello Connors, Santa Rosado, and looks like Artemis Diaz standing here. And there's a public testimony microphone just behind the woman there with the camera. And again, in order of how you arrived, Isabello Connors, Santa Rosado, Artemis Diaz. And the sign-in sheets are actually outside on the table. My apologies. So if you're willing to offer public testimony, please grab one of those sheets and bring it in. How are you?
Okay. Al paso, slow. Okay. Okay.
So good morning, ma'am. If you could just state your name and affiliation for the record, and you have the floor. Give us your thoughts and try to...
Buenos días.
Buenos días.
Good day.
Mi nombre es Santa Rosado.
My name is Santa Rosado.
Soy residente de Jamaica Plain,
I'm a resident of Jamaica Plain,
activista comunitaria y miembro de Make a Coalition for Hacer la Salud Asequible.
activist, community activist, and a member to make healthcare affordable coalition.
Primero quiero agradecer al Consejo de la Ciudad de Boston por darnos la oportunidad de expresar nuestra profunda preocupación por la mega fusión liderada por Beth Israel Lahey.
First, I'd like to appreciate the Council of the City for giving us this opportunity to express our profound preoccupation for the mega fusion that is being led by Beth Israel and Lahey.
Si esta mega fusión es aprobada,
If this mega fusion is approved,
inevitablemente aumentará el costo de la atención médica.
it's inevitable that it will be, the amount will go up of attention, medical attention, and reduce the
El acceso a los hospitales comunitarios,
and reduce the access to the hospitals, the community hospitals.
a las primas de seguro médico se dispararán.
And the cousins of medical insurance would be skyrocket.
Afectará directamente
This would affect directly
a la clase trabajadora y a la comunidad de color,
the working class and the community of color.
a nuestra comunidad que en gran parte depende de seguros de salud subsidiados, como lo son MassHealth y Health Connector.
And our community, in grand part, the insurance that are subsidies as to Mass Health and the Connector, Beth Richards and Lahey, will have a clear trajectory to serve communities
Afluentes,
affluent,
no a nuestras comunidades.
not our communities.
Por esto, instamos a que el Consejo Municipal de Boston exprese una fuerte oposición a esta fusión y pida al fiscal general Maura Heller que investigue este proceso minuciosamente de una forma completa y transparente. Muchas gracias.
For this instance, the municipal of Boston expressed a very strong opposition in this fusion and this merger, and asked a fiscal general, Maura Healy, to please investigate this process very closely in a form completed and transparent. Thank you.
Thank you.
Thank you very much, Senator Rosado. Welcome. Good morning.
Good
Please
morning.
state your name and affiliation for the record, and you have the floor.
Okay. My name is Isabella Connors, and this is my colleague Amatosh Sahani. We are here just representing some students from Massachusetts College of Pharmacy and Health Science. We are here today in opposition of the 13 hospital mega merger. As a student in a healthcare institution, we have learned a lot about the medical field and how hospitals function, and we believe that it is vital to stop this merger since it will have detrimental effects in various groups in the community. In the 13 hospital Beth Israel Lahey merger, it would have numerous adverse effects on low-income communities, which include but are not limited to reduced access to health care, lack of health care service, an increase in premium for medical services. This results in elimination of local and low-cost hospital. There would be a shortage of essential health care services available to the local community since they wouldn't be able to compete with Beth Israel and Lahey's. Consequently, people would be forced to go to more expensive hospitals in Boston, which they cannot afford due to the rise of cost and lack of resources. If this merger goes through, Beth Israel and Lahey would control more than 30% of hospitals, primary care physician visits, and the emergency rooms in Massachusetts. This substantial control over the healthcare industry in eastern Massachusetts will result in a reduction of competition, which will result in surges in prices. This is proven by a study conducted in March in 2016 by researchers in Northeastern University. This rise in price could be due to monopolistic behavior, which could also deteriorate the quality of the care due to diseconomies of scale. A large number of low-income families would be forced to travel long distance and pay higher prices for basic access to health care. Additionally, this merger would eventually drive the remaining competitors to either reduce their service or shut down completely. If this merger goes through, insurance premiums would rise due to the consolidation of these 13 hospitals. According to a study conducted in 2015 by the America's Health Insurance Plans, the rise of consolidations in Ohio, Missouri, and Georgia have been strongly correlated in increased monthly premiums. The aftermath of the merge would quite possibly entail this dilemma for Massachusetts as well. We have dedicated our future to help save and improve lives of others, and in order to do so, everyone should have equal access to affordable and efficient health care. Instead of progressing towards this fundamental goal, this merger would take healthcare several steps backwards. And we would need to stand against this together, not only to keep a balance in the economy, but also to maintain equality in healthcare. For everyone's benefit and equality in Massachusetts, I urge you all to vote against this 13-hospital mega merger and make healthcare affordable, accessible, and sustainable to the people of Massachusetts.
Thank you very much.
Thank you.
Isabella and Artemis. Good morning. Welcome.
Good morning.
Please state your name and affiliation for the record. Su nombre.
Buenos días.
Di tu nombre y tu afiliación.
Buenos días, mi nombre es Artemis Díaz. Soy residente de South Boston, soy una activista comunitaria. Soy miembro de la Coalición para hacer una salud asequible y miembro de South Boston en Acción.
Good morning. I'll try to. Good morning. My name is Artemis Diaz. I am a resident of South Boston. I am a community activist. I am a member of the Make Healthcare Affordable Coalition, and I am I'm active member of South Boston en Acción.
Quiero dar las gracias al Consejo de Boston, de la ciudad de Boston, por darnos esta oportunidad, por traer a la luz este proceso y darle la oportunidad a la comunidad para que expresemos nuestra profunda preocupación por esta mega fusión de Beth Israel y Lahey.
I want to thank the Boston City Council for the opportunity. I want to thank you for your commitment and for bringing to light this process in opening the fan so the residents of Boston, the grassroots, have the opportunity to express our profound concerns regarding this mega fusion led by Beth Israel and Lahey.
Si esta mega fusión es aprobada, los hospitales tendrán tendrán el poder absoluto de mover a nuestros médicos de cabecera de los hospitales comunitarios para centros más rentables. Esto solo no es un problema logístico en términos de transportación a nuestros envejecientes, sino también para las personas de necesidades especiales. Sino también para las personas y también para lo que se hace humanitariamente con nuestros doctores, que son también nuestros proveedores.
If this mega merger is approved, these hospitals will have the absolute power of market, and they will have the power to canalize and move our primary care providers from our local hospitals to centers that are more rentable, the higher price centers. This will not only create a logistic problem in terms of transportation for our elderly and for our special needs individuals, but it will also create a humanitarian crisis referring to the cultural sensibility that our community deserves. In accessing to health care with providers that they trust and that are closed.
Por eso insto a este Consejo de la Ciudad de Boston a expresar fuerte oposición a esta fusión y a la Fiscal General a que investigue este proceso minuciosamente de forma transparente. Gracias.
This is why I respectfully request from the Boston City Council to express a congruent opposition to this mega merger and ask Attorney General Maura Healey to investigate this process in a complete and transparent form. Thank you.
Any additional testimony?
Yes, we
do
have
have
one.
it. Good.
Lydia. Ready? Right here. They're waiting for me. Oh. Sorry.
Hey, good morning. How are you? So if you could please state
Good
your
morning.
name and affiliation for the record.
Yes.
Case
Can you hear me?
Affiliazione.
Okay. Hi, I'm sorry about that. My name is Lydia Vega, and I'm a proud member of the Make Healthcare Affordable Coalition. As you know, there's over 60 members, diverse members from throughout the communities. And I just wanted to talk a little bit more about our efforts. Unfortunately, there wasn't enough attention, especially media attention, regarding the issue. So we actually held our own mini roundtable discussions throughout Jamaica Plain to kind of inform, because we're all community activists, like within our own communities. So we informed our own community because unfortunately there wasn't enough attention around it. So most of the narratives that we've heard, the folks had expressed that the impact regarding the merger and how much, basically how much it would impact their daily lives and eventually take control of their finances, their personal daily lives. So I just wanted to add a little bit about that because I know that Hanoi spoke about it because unfortunately folks in the community couldn't attend the public hearings because they were at 5 o'clock. Also, they didn't have the language capacities. So I just wanted to add that as well. Okay. And I just wanted to express, too, that the reason why we're here at the Boston City Hall was because we do realize that you guys have a little bit more power and influence, and we were hoping, to seek your support in urging the Attorney General just to put a little more attention to this merger and do a full report in terms of conducting a transparent review of the merger. And then, because we're really hoping that, you guys can just advocate a little bit more about, help us amplify our efforts in terms of diligently reviewing the merger. And on that note, I did want to talk a little bit, unfortunately, one of our coalition members, he couldn't make it today, so he did ask for us to submit a testimony on his behalf. His name is Christopher Noble. He's also a student. And so I'm just going to read it. I'm going to try to go as quickly as I can. The Massachusetts State Legislature approved a budget last summer that included $16 billion a year to cover the 1.9 million Mass Health recipients who depend on this program to live. Mass Health is an invaluable resource for the over 30% of the Commonwealth who rely on its comprehensive coverage. But the prices that the state have to pay, particularly for pharmaceuticals, is the highest in the nation. And it's a desperate need for reform. In order to continue providing this essential social program, the state needs to enact drastic healthcare reform that will stir competition in the public interest and result in a lean and efficient health system that ensures that the neediest are covered. The 13 hospital merger will not facilitate healthy competition that drives down prices, but it will foster the accumulation of wealth for corporations over the health of the people of Massachusetts. Massachusetts does not need another partner's healthcare. What Massachusetts needs is a single-payer health system. Last December, the Massachusetts State Senate approved the healthcare cost containment bill that included a benchmarking bill that would lay the groundwork for enacting a single-payer health system. And for this new system, if it would prove more cost-effective, and that what the state would be paying it currently. But there is no opportunity for the Commonwealth to maintain a champion or effective and inclusive government programming. By enacting progressive healthcare measures that improves access while also reining in costs for the profit industry, excuse me. So this 13 mega hospital merger will not improve access, and it will not improve the out-of-pocket expenses that most folks pay in Massachusetts, who are already struggling to make the ends meet. Healthcare costs in Massachusetts are like the highest in the nation and the highest in the world. And is that going to be our legacy? For the betterment of the people of Massachusetts and for the spirit of making access to high quality health care for those who need it, please help us oppose the 13 mega hospital and throw your political weight behind progressive health care, namely the single payer. Thank you. Thank you for this opportunity.
Thank you very much for your time and attention and your testimony, Lydia.
Thank you.
Anyone else wishing to offer public testimony at this time may do so. Seeing and hearing no additional desire for public testimony, that will conclude the public testimony portion of this hearing, and then I'll turn it over for just a final comment from the both lead sponsors, City Councilor Tim McCarthy, followed by Councilor Ed Flynn.
Thank you very much, Mr. Chair, and thank you everybody for being here, for both panels as well as people who spoke after. I think the goal, as I stated at the beginning of this hearing, was to be educated, and this certainly was a forum for that. I want to thank my co-sponsor, Ed Flynn, for helping put this together, and we'll report this out tomorrow, and I think that as I see it, it's great for every city councilor, all 13 of us, to review the tape if they weren't here. They had an opportunity to ask questions, better educate themselves on how they wish to proceed. As we also stated at the beginning, this isn't a city council matter, but this was an educational forum, and I appreciate everybody who took their time today to help us come to conclusions. So thank you very much, Mr. Chair.
Thank you, Councilor McCarthy. Chair recognizes Councilor Ed Flynn.
Thank you, Councilor Flaherty, and thank you, Councilor McCarthy, for both of you for your strong leadership on this issue. Councilor McCarthy, this was a great opportunity for the councilors to learn more about how this merger would impact residents across Boston. So we want to say thank you to you for your hard work in bringing us together. I don't pretend to be an expert on this issue, but it was very informative, and I learned a lot during this hearing. I want to thank everybody for testifying, and I want to thank the experts for educating us, but more importantly, I wanted to thank the people here from South Boston Action for being here and for speaking about what impact this really would have on the poor, the needy, low-income families, the elderly, the disabled. So I just want to say thank you for being here today, and we have great respect and admiration for you. Thank you.
Thank you, Councilor Flynn. Take this opportunity to thank both lead sponsors, Councilor McCarthy and Councilor Flynn, and very informative for me. There was a diversity of opinions here with respect to this merger, so well versed, obviously, from multiple sides, and at the same time, we'll have a committee report and move this out of committee for Wednesday. So without further ado, with respect to Docket 0382, order for a hearing regarding the proposed 13 hospital merger of Caregroup Incorporated, parent company of Beth Israel Deaconess Medical Center and Lahey Health Systems. The Committee on Government Operations is adjourned. Thank you.